Now, confusion reigns over our vaccine rollout this morning with conflicting advice over who should be getting the AstraZeneca jab.
And it's hardly surprising just how the official advice has changed over the last few months. When AstraZeneca jab was approved for use in Australia on February 16, we were told it was for people over the age of 18. Then it changed on April 8. This was Chief Medical Officer Paul Kelly, who said it was only for people over the age of 50.
Have recommended an increase in the age range for those who should be using AstraZeneca from 50 to 60 and above.
OK, well, that was obviously Greg Hunt when that changed June 17. They said that it was recommended for people 50 to 60. And on Monday this week, just 2 days ago, we heard this from the PM.
Does that mean that people under 40 will be able to talk to their GPs and get the jab immediately?
Well, if they wish to go and speak to their doctor and have access to the AstraZeneca vaccine, they can do so.
So, Health Minister Greg Hunt joins us now from Melbourne. Minister, good morning to you. It is a bit of a dog's breakfast, is it not?
Good morning. No, with respect, the medical advice hasn't changed, and the medical advice from what's called the Australian Technical Advisory Group on Immunisation is that for over 60s, AstraZeneca is the preferred vaccine, and for under 60s, Pfizer is the preferred vaccine. That's what has been received from the expert body, and that remains the case. And it's always been the position that people under that could nevertheless access the AstraZeneca through what's called informed consent. What we've done this week is add for the general practitioners and for Commonwealth people who are administering under the vaccine program, what's called medical indemnity, and that's something we've worked through with the AMA and the College of General Practitioners. So over 60s, AstraZeneca is the medically advised preferred vaccine. Under 60s, Pfizer.
Well, with respect, the AMA and the College of GPs say they weren't consulted, there was no communication, among other things, and some have said it's been an absolute shambles. How do you respond to that this morning?
Oh no, we work constructively with everybody. We've worked with all of the parties and with regards to the medical indemnity. Indeed, I met with the RACGP on Sunday about the medical indemnity, and that was something that they were very, very strongly pushing for, and I'm pleased that we've been able to secure that support. And I think that that just provides the capacity for GPs during the course of what is a unique program to have that confidence, to have that backing, to know that we've got their back, and to be able to support them.
Minister, can you just explain exactly who you told about this announcement before it was made publicly through the media? Because the AMA, the Queensland Health Chief Health Officer, Victoria Health, the College of GPs, the GPs and the practitioners we've been talking to this morning all say they were surprised by this announcement. So who exactly did you tell?
So in terms of the medical indemnity, we've discussed those elements, and I know that the AMA and the College of General Practitioners were very keen to ensure that we had this indemnity, and I met with them the day before. And as these things are ready, they are announced, and I think that that's the process. One of the things, the points with the pandemic, all the time with a global pandemic, we have to adapt. And by adapting, that's what's actually kept Australia safer than almost any other country in the world. You know, difficult, challenging times that we've all been through. But our challenges, when I look at the loss of over 125,000 people in the UK or 625,000 people in the US, our challenges are mercifully very different to others. So it's difficult now, but we'll get through this. We had 126,000 people come forward on Monday for testing, 126,000 people come forward for vaccination, and my real message is please keep coming forward for vaccination when you're eligible. If you can do that, it will help protect you, it helps protect the nation, and we've now had 7.5 million vaccinations, and that's making a real difference.
Bear with me, I'm just trying to work this out, and you can clarify. So you met with the College of GPs on Sunday. And then the Prime Minister announced on Monday that people under the age of 40 can get the jab immediately. But you didn't tell GP's peak body that this was going to be happening a day later. Why not?
Well, all of these things are always subject to decision, and what I said is that we would take it forward from here. And so
Except that it doesn't answer, sorry, the question that Karl just asked. Why wouldn't you give GPs the heads up when they're the ones who are they're the ones who are copying all the phone calls from people who hear that announcement? They call the GP receptionist and they go, "We have no idea. We've heard about this at the same time you did."
Well, I think the important thing here is they advocate for a policy change, and then we listen, and then we respond. And so, having advocated, we did listen, we did respond in terms of the medical indemnity. So, oh no, it's they were notified at the end of the National Cabinet, and I think that is one of the things that we have to do. We have to take on board the advice. Having taken on board exactly the advice about medical indemnity, we were able to take it forward, to argue for it, to push the case, and we're going to places we've not been before. And we're doing that because, as a country, how is it that we've had mercifully 0 lives lost this year to COVID caught in Australia in a world of over 2.1 million lives lost? It's because we've acted quickly, because we've adapted, and that's one of the things we do, and it's a challenge for everybody.
I'm sure.
And I do understand this, that states will have to make decisions on borders and their safety equations and lockdowns, and everybody has to move quickly. And so I thank people for adapting, but I, above all else, encourage them to please, keep their distance where they're in a situation where they might be close to somebody that they don't know, that they're not sharing a house with. Please keep coming forward for testing, and then finally, above all else, when you do have the opportunity to be vaccinated, please do not wait. Come forward for your first doses. Come forward for your second dose.
Okay, well, the Townsville Mayor said today she hopes that the state and federal authorities can get their act together. I think consultation and communication is key to that, and I'm sure you'd agree it could have been better in this situation. And we look forward to talking to you again, Greg, in the coming days and weeks.
Thanks, Minister.